Bonjour tout le monde, bienvenue à cette conférence de presse pour faire le point sur la situation de la COVID-19.
So welcome to this press conference to go over the COVID situation in Quebec. The Premier of Quebec, Mr. François Legault, is with Mr. Christopher Skid, the National Director of Public Health, Mr. Horatio Arruda, the Mayor of Laval, Marc Demers, and the Regional Director of Public Health of Laval, Mr. Jean-Pierre Trépanier. Mr. Premier. Yes. Hello, everyone. Is it working? Yes? All right, Mr. Arruda, yes? All right, so listen first. The mask that I am wearing was sent by Shea Weber. I can tell you that he doesn't hold a grudge because last January I had proposed exchanging it and he still sent me a mask. And I want to take advantage of this to say that if the Canadians get to the series, unfortunately won't be able to have a parade this summer. So I just wanted to be quite clear on that. But we're not working very hard on a scenario, on an alternative scenario. I also wanted to say that the Canadians mask was made by Image Folie, a South Shore company, and Marc is going to like that because the fabric comes from Laval. So I take advantage of this to salute our guests who are with us today. First, Sainte-Rose, from the riding of Sainte-Rose, who's also my parliamentary assistant, Dr. Arruda, Marc Demers, so the mayor of Laval, and Dr. Trépanier from Laval Public Health. So, as you know, Laval was one of the most affected zones during the crisis. I would like to thank all those who contributed to try to minimize the negative impacts. We know that in Laval, for example, we had a lot of employees missing in a lot of residences. Today, still, we have replacement staff that is not necessarily working full-time, and I'd like to take this opportunity to thank Marc for the work done by the City of Laval, because the City of Laval very quickly supplied a lot of locals, or rooms rather, to have transition beds. There are employees from the City of Laval that made a lot of calls. Even Marc is still making calls to older people, either in residences or people who live alone. So that is really beautiful solidarity despite a difficult situation in Laval. And as I was saying a few days ago as well, we sent 250,000 masks to Laval, and of course, the 6 million that we announced for all public transportation companies of the MMC, part of it is going to go to the STL, so the Laval Public Transportation Network, and it is important to wear a mask in public transportation. With the reopening of stores on Monday, there will be more people on our buses, on our metros, so it is very important to wear a mask. It is also important, and we've had the opportunity of having a good meeting this morning, and the Minister of Municipal Affairs, André Laforêt, is working on this file to see how we can also come and financially help the cities, the municipalities, because you can understand, for example, that there were losses of income that are very significant in the Laval Public Corporation, public transportation. So there's a deficit that is becoming worse day after day, week after week. So I do wish to reassure Marc that we are studying this file. We're also talking about it with the federal government. The federal government was telling us that they wish to help the cities, so it's important that we do it in a coordinated manner. The government of Quebec and, amongst others, the public transportation companies, well, yes, there is work to be done on this area, on this end. Numbers, 82 deaths, a total of 3,800. So I offer my condolences to all the families of the victims. It's important when we look at the number to clarify 25 of those 82 deaths are deaths that took place over 5 days ago, so these are not of the past couple days. Concerning the number of positive cases, we're at 45,495 confirmed positive, an increase of 720. It is important to remind everyone that amongst those 45,000, there's at least 13,200 that are cured. Now, the hospitalizations, we are at 1,504 hospitalized people, so that is 41 less than yesterday. In the past week, there's 124 fewer people hospitalized, so that's significant. In intensive care, 176 people, a decrease of 7. A decrease of 14 in the past week. So as you can see, the number of people in hospitals is slowly going down. It's encouraging because, yes, we are following the number of cases, and yes, we are following transmission, but as you know, the main objective that we have is to flatten that curve in order to avoid overloading our hospitals. So seeing the number of occupied beds decrease is good news. Now, a subject that I want to talk to you about today, day camps. A lot of emails, a lot of parents who are concerned. I am very happy to be able to announce to you today that we've got the green light from Public Health in order to be able to open on the 22nd of June all day camps. Same date as usually, basically, 22nd of June. There are measures that are being proposed for day camps, so we're going to have smaller groups. There's going to be social distancing guidelines. What this means is that now we have a big challenge to recruit monitors. We are going to need more of them in order to be able to go work with the children. So I would like to call out to all teenagers, young adults that want to have a nice experience working the entire summer with young people. I'm going to start around me, like Marguerite and Julien told me that if I was going to say their names, that they would work this summer as monitors rather than receiving the CERB. So I hope that this will inspire other young people. I'm really calling out to people. It's important. We have people who haven't gone to school for a certain number of months. We need, and the children need first to spend some time together to see one another, but also to move. And so we need monitors. So I launch out that call to all young people. My daily thanks. Well, I'd like to take advantage of Marc's presence to thank all the mayors, prefects as well, in all regions of Quebec. It was, up until now, 10 really intense weeks. And I know that many of you have been working 7 days a week trying to help, bringing volunteers with you. So I really wish to say thank you to all the politicians in the cities and also all the employees of all cities in Quebec. And I would also like to end by saying that, you know, the crisis is not over. It's still difficult. There's still a lot of adjustments to bring. Not everything is perfect. I see some people who are criticizing. I would ask you to be indulgent. We are going through a crisis. If I speak, for example, of CHSLDs, well, before the crisis, and we've often said it, there were thousands of positions that were unfilled. To that were added people who are absent. And we have people who came and replaced. We already had a lot of part-timers, but now we have people who are not used to it. They don't have all the qualifications. They're doing everything they can. So I would ask all Quebecers to please understand that we are not in a normal situation and to please be indulgent, to work as teams, to try to work on solutions rather than just working on problems. And it is as a team. You know, the Canadians, a team has to work together. And it is the time to show that Quebecers are capable of working together. And if we work as a team, we will win the game against this virus. So I count on all Quebecers, and I thank you.
A few words in English. Good afternoon. This morning I had a good meeting with the mayor of Laval. The situation is getting better in Laval, but we must stay vigilant. One of the ways to do so is by wearing a mask in public transports. That's why our government has given 250,000 masks to Laval for public transports. We're also financing the city's procurement. I know many people are concerned about day camps for kids. I'm happy to announce that the public health authorities have given us the green light to reopen the day camps on June the 22nd. Of course, it will be with distancing rules, but it's very important for kids to play outside, to play together. I encourage teenagers and young adults to become monitors. Cities are looking for more monitors, and it's a great experience. So we continue to gradually reopen, but if the contagion restarts, we'll have to come back to a pause. So nobody wants that, and the best way to avoid it is to respect the instructions. To win this battle, we must play as a team. I'm counting on you all. Thank you. Sur ce, je passe la parole.
And now let me hand the mic to the Mayor of Laval, Marc. So hello everyone. My salutations to the Premier, Dr. Arruda, and my colleague Christopher Ski, and of course Dr. Trépanier, Director of Public Health in Laval. As of yesterday, 4,950 people have been confirmed in Laval with a diagnosis, 475 deaths. So allow me to offer my most sincere condolences to the families and loved ones of the people who have passed. I wish to thank you, Mr. Premier. A very sincere thanks for the 250,000 masks that will be made available to the citizens of Laval. Our teams are working to establish a plan to distribute these masks in collaboration with community organizations to be able to help the most vulnerable population in Laval. Next Monday, we will be starting the first phase of the deconfinement period of Laval. Many businesses will be opening their doors. It is capital to encourage our local companies and merchants, and it is just as important to continue respecting all guidelines. The pandemic hit us full on and created a humanitarian, sanitary, and economic challenge. In Laval, our solidarity has allowed in the past few years to create a community that is animated, that shows solidarity, that has a strong economy, and has healthy finances. I am convinced that this same solidarity is essential in order to be able to face the present pandemic. It is what will allow us to ensure our full recovery and to succeed our economic recovery. And I would also like to take this opportunity to tell all people in Laval who had a diagnosis that if they wish to participate in the research of Dr. Tardif, to go to all screening centers. It's signed, but you can go on callcoronet.net to put in your name and participate in this research, which is, we hope, will be able to be successful to help us find solutions to this pandemic. So I wish to thank you for your attention. We will now go to the question period.
Yves Poirier, TVA Nouvelle.
Bonjour à tous. Je voulais vous demander...
I wanted to ask you about the day camps, of course, a lot of expectations on the part of parents. Mr. Legault, do you have any data or clarifications on the ratio of children? There are many questions about this, also in CPEs, daycare centers. What can you say on day camps in terms of ratio? How many children per monitor? How will it work? I don't have the exact number. I'm sorry that I don't have it, but I will make sure to send it to you as soon as somebody can send it to me. What is clear is that what was done is try to make sure that there be fewer large groups, that there be fewer children. They'll be able to stay in their own bubble amongst themselves. Generally speaking, it's about half of children per monitor, if I recall correctly. But since the work is going on, operationally speaking, I don't want to give you wrong information. But the principle is to make sure that there be fewer children, that the groups be smaller. That's why it's important to have more monitors, which will allow, in my opinion, to decrease the impact of transmission in those camps. However, it has to be understood that the virus is circulating. Young people are people who go through it relatively well. So it doesn't mean that because there's going to be cases in one day camp that it's going to be a catastrophe. I want people to understand as well that it is also part of, going back to life. But we will keep a very close eye on it. And when there are cases, there will be investigations and we will take over those groups. If we're thinking about day camps, we're thinking about public pools, especially if it's warm. We're not planning on the reopening of public schools. What are you announcing about that? It's coming. Whether it be the pools, whether it be all the activities that have not yet been opened, we are preparing a calendar that will be announced to you in the next few days, but we are going gradually. Our intention eventually is to open the pools, but we're not there yet. I have the answer. You see that people are following. The maximum ratio, day camps 3 to 4 is 1 per 4 children. The 5 to 6 years of age, one monitor for 5, 7 to 8, 1 for 7 children, and the others from 9 to 11 years old, 12, 14, and 15 to 17, it's 1 for 10. The number 10 is a little bit the number that is being kept in a lot of elements. You'll see yesterday that we announced the outside gatherings and private homes to 10. But for the smaller children or the younger children, we need more monitors. So the ratio 1 to 4, 1 to 5, and 1 to 7. Mr. Premier, who were you targeting by saying that certain spend their time looking for problems rather than solutions? And what are the risks of seeing Quebecers not play as a team? I wasn't targeting anybody in particular, but I do hear criticisms. And what are the risks that Quebecers not play together? Well, it's first, it's important to follow the guidelines, to be 2 meters away, to wear a mask, especially in public schools where there's a lot of people, particularly in public transportation. It is important to protect oneself, but also to protect others. So there is an aspect that is more one of personal responsibility towards others, and it is important that it be followed. If it's not followed, well, we're going to be forced to stop the openings that we are announcing right now, whether it be the pools, what we'll do eventually, with the restaurants, in the tourism sector. We haven't forgotten everyone. It's just that we are going gradually. If, unfortunately, people don't respect the 2-meter distance and there's more contaminated people and more people possibly that use our hospital services, well, unfortunately, we will be forced to stop with the deconfinement measures. There are people in the Oka region that fear the contagion of the virus and who are preventing others from visiting the national park. and who have roadblocks in the community. Are you tolerating this situation? Well, we're having conversations. I understand that certain nations, representatives of Aboriginal nations, be worried about the possibility of getting infected by people who are coming from the outside to go into the park at Oka. It's legitimate. We are trying to have conversations with them to fix this problem in a friendly way. Mr. Trudeau this morning talked about vacation camps because a lot of children go to day camps, but many others go to vacation camps while their parents are at work. The problem is very different because people sleep there in dormitories very often that are very crammed. What is going to be done on the Quebec aspect for this summer? Some people have already announced closures. Well, we're not there. It's the same situation as in hotels. I would like to eventually that Quebecers who probably won't be traveling in other countries, well, I would like for them to take advantage to visit our beautiful Quebec and the beautiful regions in Quebec. But that presupposes, once again, going gradually, putting guidelines in hotels. Same thing in vacation camps when young people sleep there. We're not there yet, but I do hope to be there soon. Do you think that the season will be probably shortened? Well, it depends when you see the beginning of the season. Of course, it's not going to be at the beginning of June. So will it be the end of June? Will it be July? That will be part of the discussions with Dr. Arruda and people responsible for public health. If you'll allow me, Mr. Primo, I would like for people to understand that we are deconfining. We are giving clear prescriptions on the methods to be taken. It's as if you'll understand that the next steps are going to depend on the success of these ones. So I don't know if you understand, it's as if I was giving you an antibiotic treatment or chemo for cancer, because I compare this disease to a cancer that is killing our economy. It really is an atrocious virus, I have to say. So if we slacken and we realize that people, because they haven't respected the prescription, we're going to have to come back to stage 0. It's as if the cancer, after having succeeded in controlling it a little bit, we give it room again. And I'm trying to create that image so that you understand that you are all in this team. You are all stakeholders in this, and the behavior of certain people, and if most people listen, there's always exceptions in life, but if most people listen to the guidelines, we will all win in the end. But if we don't, I'm going to tell you, it's going to be really hard. It's going to be hard to have a second wave. It's going to be hard in the summer. So it's very serious. We can't panic. We're very happy to see that people are feeling relief with the announcement that we've made for social gatherings and things like that, because, we're not computers. We are human beings with emotions and feelings. We have eased things a little bit for people's mental health, and the operation outside of Montreal is going well right now. In the metropolitan area, things are still fragile, but everywhere, guidelines have to be followed, because we can say it, but you are the ones who act. We also apply what we tell people. And I want to mention it because it's very important what we are experiencing right now, the moment we're going through. If it becomes total freedom, I'll tell you, we are going to once again be totally imprisoned soon. And I think that it would not be nice to have to go back to it before the 24th of June because we didn't respect the elements and because our healthcare system is overwhelmed and because we didn't collaborate with with what is going on. I find it really important to reiterate that point. We're repeating it, but it's very serious. The national director is begging you to apply the guidelines because the success depends on your social contact, on your social distancing. Wear the mask, practice respiratory hygiene and etiquette, but please don't do things clandestinely that we will all regret. Mr. Legault, why have withdrawn the scenario of remote schooling for September? It had been talked about last week by Minister Roberge. Is it because of the fact that people were unhappy about it? No, not at all. I have always wished for schools to be able to reopen as quickly as possible because there are negative impacts that are very significant if we don't reopen the schools. I understand that there are negative impacts when we open them as well in the case of a pandemic. But the fact that young people cannot see their friends, cannot have a normal life, it is truly not something that we wish. And taking into account where we are at right now in the pandemic, I believe that we could, if we respect the guidelines, we have good hopes that all students will be able to physically be at school, at CEGEP, at university during back to school in September. That's what we're targeting. Dr. Arruda, could you explain what would give the green light? What are the factors that you are looking at for day camps? Well, first, it has to be understood that day camps, well, first, it's a balance. We are regrouping a population of people who are young, first of all. Young children, the monitors usually are not in the groups that are at risk either, and usually they're healthy and fit, first thing. So if ever there were to be transmission, the impact of that transmission would be minimal for those individuals as such. Could they then transmit the disease to others, etc.? That's possible, but we know that there's going to be circulation of the virus. The children who are in day camps or the monitors who may have the disease and will have symptoms will be investigated, and we'll make sure that we be able to isolate them, that there be no transmission, that they not be in contact with older people, etc. It's almost like the normal recovery. It's almost like when we reopen schools regionally, it's the same thing. And we have to balance things out. What is the impact in children of not having a social life at all? I mean, it's all very good to have dinners among friends for grown-ups, but the children don't have a place to be able to relearn, to be part, to socialize. And that is part of things that citizens have to learn. So that is why we've done it with, keeping monitoring of the situation. And also with measures, we are decreasing the probability of transmission. There are certain day camps, or certain camps, not day camps, but the specialized camps for specialized clienteles that will be able to open, probably. As far as summer camps as such, we're still thinking about it, but there are camps for very high-risk population that they may become dependent. So it's always a balance. We won't be able to stay locked up ad vitam aeternam. People will, run away. They will do things surreptitiously. So we need to have a balance between all that. It's an analysis, I would say. Epidemiological, with the risk factors. It's discussed with many experts who have all sorts of points of view. But now is when things get more difficult because, closing is easy. You just close. Reopening, what speed and how do we monitor, how do we measure, and so we have to keep doing it. We have to monitor and measure constantly. Hello, everyone. Mr. Premier, we've just heard you launch a call out to teenagers to become monitors in day camps. Except that yesterday, your Minister for Education, Mr. Roberge, did not exclude the possibility of having classes over the summer for teenagers, high school, to prepare them for back to school. Is that not a bit contradictory? Because they can't do everything. Well, first, what Jean-François said was a scenario. Already, Jean-François said there was no question of prolonging the school year or of starting it earlier in a general way. Now, I've often said so. There's 20–25% of children who have learning difficulties, and some amongst those did not go to school and haven't in the past 2.5 months. So they will have a long period. Could we help them during the summer to be able to catch up a little bit with a few exercises? That's part of the scenarios that we're looking at, but it would not be in a generalized way. And Mr. Arruda, you just mentioned that every step is built on the success of the preceding one. Today we're talking about giving the green light to day camps, but have things gone well in the past 10 days in primary schools that were open outside of the Montreal metropolitan area? Have there been outbreaks of COVID-19 in those primary schools? Have you heard of any cases? Listen, no problematic situation have been reported to me. Cases probably there will have been, just as there were in daycare, but the situation is not problematic. And you'll remember as well what is very important. Cases in children, thank goodness, for the most part, it's almost like just a little cold, nothing worrisome. To my knowledge, anyway, and it's possible that I'm not aware of everything that is, but because a lot of things are going on, but it wasn't reported to me. Had there been a professor, for example, or a child that would have ended up hospitalized or intensive care, of course I would have heard about it, I'm convinced of it. But the experience outside of Montreal, as expected, taking into account the situation and the circulation, and there will be circulation, it will continue. It's not because they are at less risk and that it's declining, that there are no cases in the community. There's been cases pretty much everywhere in Quebec. In Gaspésie, the Île-de-la-Madeleine, there's still some in Bas-Saint-Laurent. It's not necessarily transmissions from Montreal, it's just that the virus is present. But the more we slow down social contacts, the more we avoid exposing older people as well. So when we open a school, we took professors and teachers that are in good health, etc. And nothing was reported to me, which is encouraging as an element. In Montreal, first, there's a greater density of the population, and second, there's all sorts of groups and individuals who may or may not understand the guidelines. The challenge is more important. When I talk of Montreal, I'm talking about the metropolitan area. I'm sorry for Laval. I do include Laval, because we tend to say, Montreal, but it's a metropolitan area. Now the risk is greater because the fragility of the system, they are not a little below 1. It's a little bit below 1, but it can easily go up. So that means that more, like every infected person can infect more than 1. And if everybody who is infected infects 2, well, the more we're dense, the more we're closer, the higher the risk. And that is why we have to be so much more prudent in the metropolitan area. But we still have to be prudent everywhere, even in Quebec, There's the virus is present in certain people, even asymptomatic people, so it could spread. So yes, step by step, analysis by analysis, and the directors of public health as well clearly look at what is going on in their territory, such and such a neighborhood, etc. And I can tell you that I spoke with the Minister of Education, Jean-François Roberge, yesterday, and he was telling me that it was beyond our expectations. It went really well. So it's been a true success. We were expecting for things to be more difficult in certain places, but it has gone very well. So that's encouraging for the month of September. And if you allow me, parents and children were happy, and it shows you the mental, psychological aspect of parents. It was like a delivery, to be able to be a little bit more freed from the role of being a parent, always, while still being responsible. It's not a question of that. But the children were so happy to see their friends back.
Bonjour.
Bonjour.
Monsieur le Premier ministre.
Mr. Premier, I would like to talk to you about money, since you're talking about day camps. When young people were called out to be hired and work in day camps, more monitors means more money, and it's often the cities. And Mr. Demers would be able to confirm it. It's often the cities, generally speaking, that pay a good part of those costs. What will your government do? Well, listen, this is something that we're looking at. But yes, in fact, there are many mayors who have told us, we have 2 challenges ahead of us. 1, we need more monitors because the groups are smaller. 2, we have a competitor called the CERB that makes it that people are paid to stay at home. So for the time being, we're not excluding anything, but it is possible that the government of Quebec will have to help municipalities to ensure that all children who wish to go to day camp be able to do so. So the Minister for Municipal Affairs is studying that with all cities. Do you already have an estimate? No. We're working on it. And do you have an estimate of what an extra help might cost? No, not yet.
Je vais rebondir là-dessus. Est-ce que vous avez une
I'm going to
estimation
rebound on that. Do you have an estimate whether municipalities will be able to offer day camps under these conditions? I mean, if we have to double the number of monitors, well, yeah, that's what it would be. We'd have to double the number of monitors. So that's a huge challenge. A huge challenge. That is why I'm calling out to people today. I know that on the one hand, we have an unemployment rate that is higher than usual, a great deal higher than usual. So there are people who are available, including in teenagers and young adults. There's the CERB, which is perhaps an incentive to stay home a little. So there is a challenge, definitely. I'm not saying that we're going to be able to fill every position of monitor. That is one of the reasons why I'm calling out a special, I'm making a special call out. The president of the Canadian Association that represents public health is saying that the health system is going too quickly in Canada to deconfine, and he's worried about a second wave, that we won't have everything that we need to be able to face that second wave. Is that second wave being prepared at the same time as the deconfinement? Well, yes, and this afternoon, you know that I met the managers of the Greater Montreal Region CIS, and this afternoon I have a meeting just with the Laval CIS managers and CEOs, and the idea is to prepare how things will unfold. The great challenge that we have is that of staff. We know it. I've said it often. If, for example, we take just a number here, the budget for health for the year 2019-2020, so for the year that ends on the 31st of March 2020, there's over $500 million that wasn't spent by the health ministry. What does that mean? Well, concretely, it means that there are thousands of positions that were posted to improve the services in CHSLDs, in home care, in hospitals, positions that we didn't succeed in filling. And that is where our great problem came from, is that we arrived at the crisis with already thousands of unfilled positions in the health system. To that were added all the absentees. There was already a problem where half of the employees of the health network were part-time. So when we say, for example, that we want to have continuity in a CHSLD dedicated team, was a lot more difficult to have dedicated teams when we have a lot of part-timers. So the challenge that we have to get ready to the second wave is to quickly increase, first of all, the financial incentives, the wages that we pay to certain groups of employees, and to recruit and to prepare to try to have as much staff as possible. And honestly, we don't yet, we're not yet ready for that challenge. Right now, we have 10,000 employees who come from Je Contribue, so people who are new, who are not necessarily qualified. We still have 1,000 soldiers, so we have quite a challenge for the second wave. And on top of that, I would say that, we have employees who are tired, and I get them. And yeah, and by the way, the vast majority will get their time off, their vacation. There are cases where it just makes sense. In a hot zone, in the few hot zones that still remain, well, of course, it's not ideal to take a vacation tomorrow morning, but we hope within a few weeks that even in the hot zones, we'll be able to give vacation. And already 90% and more of the people will be able to take their vacation in a regular way. But if a second wave comes, are we ready? Well, not yet. We truly have to work hard to attract staff, a lot of orderlies, amongst others, full-time nurses and nursing assistants. So a lot of work yet to be done.
Hi, Monsieur Legault.
Hi, how are you?
I'm good, thank you. How are you?
Good.
I'd like to know why it's important that we open day camps, and do we worry that and measures such as allowing outdoor gatherings, will that lead to an increase in the infection rate?
Okay. We have to be careful, and that's why we are doing it gradually. We don't open restaurants, we don't open the Bell Center in Montreal, neither in Laval with the rocket. So we go gradually, but it's important that people, they stay at 2 meters of the other people, that they wear a mask when they are too close to other people. So it's very important that we continue to be in control, especially the number of people in our hospitals. I'm happy to see that we have more than 100 people less in our hospitals since a week. So we have to make sure that it doesn't restart to increase.
Specifically with day camps, Mr. Ruda, you were saying before, Dr. Ruda, you were saying before that it's important that they open. Can you explain why in English, please?
Yes, I will. You must understand that the day camps are younger people, the kids, and the monitor also is a young person. So we know that this virus is a terrible one, but is attacking especially older people and the ones who have, I would say, some medical conditions. It's true. It can happen in a 45 or 25 even person in good health, but it's rare. And kids need to be, I would say, deconfined. We have been opening some issues where for adults, but nothing for kids. And it's part of the development. You know, we open schools and kindergartens elsewhere here, and everybody's happy, is getting not depressed. That's part of the life. And even from what we were doing about, I would say what we announced yesterday, having 10 persons sharing, from 3 families sharing a meal with 2 meters respect in between families, this is already happening. You know, we should understand that at the same time, we could even say it's not happening, but it's already happening. But with these rules, we will have a better effect than if it's done clandestinely, because at least we will be able to know who went with whom. If it's clandestine, people won't tell the truth to public health when they're going to be. So we really balance, and it's also a fact of depression. People having depressions, you know, because it's not true that we can put somebody confine a society for months and months with no impact. Even those impacts can be higher than the risk of the disease actually.
We'll take the next
Yeah, and it's also important for some parents because it's fun to be a monitor during a weekend and play tennis with the 3, 4, 5 years old kids. It's another thing when they are 20, but when they are young, it's fun for the weekend. But for some parents, it's important that their kids, they go to the summer camps during the week.
Just a question for Mr. Demers.
Yeah, go ahead.
Monsieur Demers, can you just tell us why the situation is so troublesome in Laval? What led to the higher infection rate there?
Well, right now I cannot answer that, but one thing that my previous job taught me is our goal should be to make sure that we have less victims as possible for now, and make sure that we are helping everybody who's in trouble. And later on, we will be trying to find out why all those things happen, and if we have the good numbers to compare with other regions. So, you know, I was a police officer taking care for emergency situation, all kinds of trouble for 30 years. And the first thing is to make sure everybody who's wounded or hurt is being taken care of. And I believe that's what is the goal right now. And later on, I think the government has to make sure that we analyze all the situation and find out. I could say that Laval is close to an airport. Laval has a lot of people who travel because we have a lot of people living in Laval coming from many countries. I could say that the life expectancy in Quebec is 3 or 4 years more than in the U.S., and that people older are more vulnerable. A lot of things we can say, but you need a scientific analysis to make conclusions, and I don't think that's the proper time right now.
Next question.
Yes, a question about the day camps. What measures are the children and the counselors going to have to take? Are they going to have to wear masks. Can you explain a little bit what the measures are and what the province will do if these measures can't be respected? A, because of they're not respect them, or B, because they can't hire enough counsellors in order to respect the ratio?
I think we will make our best to respect the ratios. And I just want to tell you that there is even people telling that if the kids get infected, that will, as they are not so much at risk, that could be a good thing. We are not on this situation. We are opening it in a way to lower the rate. We cannot guarantee that there's going to be no case, because even kids could have been infected at home with others. It's going to be very difficult to say. But it's going to be more, I would say, some bubbles. They will not mix up with other bubbles. They will have to play. They will try to find out a way to limit the contacts in between kids. There's going to be a more distancing situation done on this. I don't think we're going to ask kids to put their masks. I think there's going to be, it's like a small family. It's going to become small families over there, trying to minimize the risk. There's going to be hygiene of the hands, which will be important. So, but it's not, and I would tell you, if somebody thinks there is going to be no cases at all, I think it's almost impossible. I think there is, but the impact of the cases is going to be low. Okay. And if we could done that in schools, I think we can do that in an attempt. Even for camps, where the kids are there for, and they all sleep together. We know that this kind of things is a good way to transmit infections. When there is a meningococcal disease, or I would say lice in your hair, there is big epidemics in those camps. Some people say that's good. They can get sick. They stay there for 2 weeks and they don't come back. But we are not still there. We're going to have to discuss this. So I think that parents can send their kids there, especially if they are not immunosuppressed or have no disease. This is a different condition. If your kid has a disease, that's another issue. But if he's in good health, I think the measures are going to be taken will be balancing the risks in the right way.
Okay, and a question for
last one.
Dr. Trépanier. We heard that there are healthcare workers going from red zones to green zones, especially at night in birthing rooms and areas where mothers are recovering from after giving birth. What do you say about that situation? Are employees actually being asked to go from red zones to green zones in Laval?
Well, of course, this is not the best way to do, but I have to say that it's not the responsibility to the public health department to give some precise advices to these different sectors. There are differences between hospital and long-term care that should be taken into account for that. But well, it's not some public health advice precisely.
We'll take next question.
Alicia Robertucci, City News, Montreal. Premier Legault, days ago, your government said despite the rate of cases and deaths in Laval, the outbreak is under control there. In Laval, CHSLDs have seen a death rate of 1 out of 7. I just want to know, how is this considered under control?
Three things. First, the number of cases. Second, number of people in the hospitals. And thirdly, the number of deaths. So right now, all those figures are going down. Not enough, but enough to say that we are opening gradually and permit people to have a more normal life.
And Dr. Arruda, just to know, you said that pools will gradually reopen. How dangerous would that be?
But everything that we're going to do is going to be different, okay? Every place where we could add hand hygiene, any place where we can make a distanciation, any place when we can reduce the numbers of persons is going to be something that is going to be done. It's clear that the access to pools will not be as before, having, I would say, a lot of people inside of the pool at the same time. There's going to be a new way to opening, with probably a limitation also of time, You could not probably stay for 6 hours because if you stay 6 hours, somebody else could not be there. So that all this kind of thing which are analyzed. And I think the best, and we work with the ones who understand there's going to be probably some issues related to showers. You know, they're gonna look at all that thing, look where we can make a change, where it's going to lower the risk. The risk will never be zero because even it's not because you're going to go to the pool that it's going to be there you have contracted. But that's all that kind of stuff that is going to be looked, and probably based on the, I would say, the size of the pool. They will calculate how many people can be there to keep the 2 meters distanciation, and to get also access to more people. The hours could be perhaps bigger, but also the quantity of persons can stay there for a long time will be monitored. So that's all things that are studied actually, and we do that with experts and with people on the field.
Next question.
Hi, good afternoon. My name is Wei Yang. I'm from the Epoch Times newspaper. I have 2 questions from the Chinese community. One is related to the screening test. The other is about the mask. So after increasing the screening capacity, data actually show that the numbers of infections were lower. We heard from different media that some countries such as Britain, Spain, Czech Republic, high percentage of testing kits from mainland China give out false results. As we know that testing kits can greatly affect the data and further impacts to the pandemic. Dr. Arruda, Premier Legault, would you please explain a little bit about the info about our testing kits, please? Thank you.
Testing kits? Okay. First of all, our strategy actually is not based on testing kids unless there is outbreaks or some certain situation that will with a lot of cases, we can do testing kids. But the testing, first of all, you should understand that when we compare tests from here, Quebec, to England or even China, there is different technologies. There is different tests with different sensibility. In fact, we have in Quebec a test that is detecting a lot, where a lot, and even when we do that on people who have the disease, we even find some fragments of virus later after they are sick. They are probably no more contagious, but this test is very sensitive. But I think that the answer to better understanding what is going on is going to be on the seroepidemiologic studies that is going to be done. It means that we will take some blood from different states of the population and analyze if they had antibodies against the virus. I would say the recent antibodies, that means that the disease was recent, or I would say the antibodies of a long time, meaning that they are recent. So it's with that information that we're going to be able more to understand the situation. And there is going to be specific studies done to understand how the test reacts before the symptoms, how many days, and afterward. That's a, I would say, combination of studies that's going to be done. And we're going to do that here in Quebec in collaboration with Canada. And as the tests have been authorized, I think last week, if I remember well, because I've got a timing issue, not knowing what day I am actually, because of continuously working. I think that those studies are going to begin in June here in Canada and also in Quebec.
We'll take the next question.
Anthony Nerestan from CBC. Hello, everyone. My first question is regarding testing. We're loosening restrictions around the province gradually, but we haven't hit our targets in terms of testing on a consistent basis. How do we justify loosening restrictions, lifting restrictions, when we're not testing 14,000 people per day on a consistent basis?
Okay, I just want to say a few things and let Dr. Arruda complete. Yesterday, or the day before yesterday, the last figure we have, we were at more than 12,000 tests a day. I'm not happy. I would like to be at 14,000, and I hope we'll be at 14,000 soon. But right now, we're one of the place in the world testing the most. We're testing more than United States, more than France, more than UK, more than about every country. We're testing a lot, but I want that we test more. But it's important because I hear some people saying that we don't test enough. That's not true. We test more than 90% of the other countries, but I want that we do more, and I want that we get up to 14,000 a day, and I'm a bit impatient about it, tell you the truth.
And I think that the Prime Minister is right to be impatient, as I am impatient. There is a lot of issues related to maintain that capacity. There is not only one reason, but we are getting up, and we will do that more. And I know that Dr. Tam told that in Canada, it's about 60,000 tests that are going to be used and needed. We are yesterday, we already had 13,000 one day, but we want to make it getting up and stable. There is always going to be some variation. It's not possible to be exactly right to the number every day, but I think we're going to have to go up, and even that 14,000 tests was 1 or 2 weeks before, if I do remember well. We got more to plan, but I think it's a machine to make work well, and it seems to be why some people have been refused if there is enough tests. It's for different reasons, interpretation of what are the risk groups, but we will do it up, and helping with the seroepidemiology, we will have a better way to understand what is going on in Quebec, because testing is an important issue for finding the cases and the ones who are symptomatic, but the seroepidemiology is another one important, because we can be aware of the ones who have been infected 1 month, 3 months, 4 months ago.
My last question, Mr. Legault, Mr. Premier, there are more and more calls for asylum seekers who are also frontline workers to be able to stay in Canada. My question to you would be, why are you not pushing for this yourself, and what do you make of those calls personally?
Okay, but first, only to complete regarding the testing, I want to be clear, Quebec is the province testing the most. Yeah. We're testing more than Ontario, more than Alberta, more than BC, of course, taking into consideration the population. Regarding the asylum seekers, there are two different subjects. I want to be clear. I'm very, very happy about the work that is done by some of them in our residences. We need them. We are lucky to have them, so it's very fine. But first, the choice to become an immigrant is done by the federal government. That's the first thing. Second thing, I understand that we have to be careful. We cannot say people coming through the Roxham or anywhere coming and asking for to become an immigrant. We cannot open the door to say, if you come illegally, if you find a job, that's okay, I will accept you as an immigrant. That's not the way it works. There are some rules for the people who would like to become immigrants, and there are some rules regarding the asylum seeker, regarding their rights in the country where they are coming from. So we don't have to mix all files together. It's two different files. So I think it's important to respect the rules.
We'll take a last question.
Hey, Dan Spector from Global. So I just wanted to ask real quickly on masks. You guys have been very clear that it's strongly recommended, not mandatory. In Côte Saint-Luc in Montreal, they are looking to pass a bylaw making it mandatory to wear masks in stores and indoor spaces. What do you think of that?
We don't exclude to make it mandatory everywhere. But right now, we want to first make sure that those masks are available. So that's why we gave masks and money in the Great Montreal to make sure that we can buy masks, give free masks to people who cannot, for all kind of reasons, buy a mask. So we first need to have the mask available. Second, so far we were lucky to see that Quebecers, they respected the rules, even if they were not mandatory. Because when you put something mandatory, it means that you have to have some police checking, giving some penalties. How much do we give? It will be so easier if Quebecers accept to respect the rules. If they don't, we don't exclude to put it mandatory.
And just real quickly on the camps, we already heard from a camp director who says with the change in ratios, he will have to rent a whole lot more space, and this is going to be a lot more expensive for the camps. Do you plan to provide any financial support to helping with these new costs they'll have to incur?
We're looking at that. We're looking at that because we know that it will be more costly. First, the groups per monitor will be reduced, the number of kids, so it means we need more monitors. Second, we have this competition in a way against the PCU. In English, how do you say PCU?
The CERB?
Prestation canadienne d'urgence.
CERB? CERB, CERB?
CERB, anyway. The $2,000 a month or the $1,250 a month for students given by Mr. Trudeau. Of course, we have to compete with that to convince people 15, 16, 18, 20 years old to work as monitors. So we'll probably have to put some money to make sure that the camps, the summer camps are available for all the kids. And I think it's very important that we have those camps. It's important for activity, physical activity, social interactions with friends. So I think it's important that, and we're open to finance a part of that.
Thanks.
Merci.
Merci tout le monde.
Merci tout le monde.
Thank you, everyone.